You've been told you have scoliosis. Well, let me explain. Dr. Fiorini here with Fiorini Chiropractic Center. Scoliosis is an abnormal curving of the spine such that the spine resembles either the letter C or the letter S when viewed from behind. Now, most people have a completely straight spine from side to side with natural curves in the neck and lower back, but individuals with scoliosis have excessive spinal curvature and in unusual directions. Now, chiropractic care can be helpful in treating this condition and keeping any symptoms of discomfort at bay. According to a 2001 article, chiropractors use different methods to treat scoliosis, including specific exercises, joint adjustments, and other types of things. Your chiropractor is a musculoskeletal health expert who understands how to treat scoliosis using natural, non-surgical means. So what is scoliosis? Well, as I mentioned before, scoliosis is a sideways curving of the spine, and it occurs most commonly in girls during the growth spurt immediately before puberty. Now, the Scoliosis Association states that about 10% of all teens have some degree of scoliosis. Though scoliosis is found in both boys and girls, the condition is more likely to progress in girls. So scoliosis can be classified as either what's called idiopathic, which means arising spontaneously, unknown what caused it, or congenital, meaning from birth. Now, the majority of these cases, in fact, greater than 80%, according to the American Chiropractic Association, are idiopathic. In some cases, contributing factors to scoliosis may include muscle problems, spasms, leg length discrepancies. Not everybody who has scoliosis, though, experiences pain or discomfort, but scoliosis can cause pain, reduce lung and heart function, and lower quality of life due to a limiting, of course, of activity. Well, the American Chiropractic Association notes that about 4 out of 5 people with scoliosis have curves less than 20 degrees, which is a situation in which scoliosis tends not to progress or cause serious problems. So who in the world develops scoliosis? Well, scoliosis is very common. It affects about 2 or 3% of the people in the United States, according to the National Scoliosis Foundation. It can occur at any age, but it most commonly develops in boys and girls, and really mostly girls between the ages of 10 and 15. Scoliosis can be congenital, inherited, and it's common for adolescents whose parents and siblings are affected to develop scoliosis as well. Adults can also develop abnormal spinal curves, though it's less common than in adolescents. Well, according to the Scoliosis Research Society, possible factors leading to scoliosis in adults include wear and tear, changes in the spine, deformities that appear later in life, osteoporosis, fractures, slipped vertebra, and infections. Well, the chiropractic perspective to this is it's usually due to a vertebra that's out of place, and we can offer a comprehensive approach to the management and improvement of scoliosis. We use adjustments to the joints, soft tissue work, functional exercises to help relieve scoliosis-related symptoms and prevent a progression of the condition. New research indicates that a well-rounded chiropractic treatment approach may have lasting health benefits for individuals with scoliosis. Now, there was a 2011 study where 28 scoliosis patients receiving chiropractic rehabilitation treatment experienced reductions in pain and disability, as well as beneficial changes in spinal curvatures up to 24 months after treatment. Chiropractors try to identify early changes in spinal curvature to help halt potential progression and symptoms in susceptible individuals. Early intervention is extremely important in chiropractic scoliosis treatment. In mainstream healthcare, scoliosis is often left unaddressed until significant cosmetic and structural changes have occurred, which makes it difficult to control the condition without aggressive and invasive treatments such as bracing or even surgery. Some of the more common approaches used by chiropractors to help treat or prevent a worsening of scoliosis include gentle, focused, specific spinal adjustments physical therapy modalities such as massage and electrical muscle stimulation, home stretching and strengthening exercises, and exercises to improve posture, breathing exercises, and foot care, believe it or not, to ensure a stable base of support for the spine. Chiropractors understand the intricacies of scoliosis and how best to care for your spine. If you're concerned about scoliosis, or if other family members have been diagnosed with this health problem, consider visiting your chiropractor for a full and thorough spinal examination. Your chiropractor can give you the care that you need and the exercises that will keep your scoliosis from progressing. Hope this was helpful.